Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today we're going to learn about your kidneys, why they are so important to our overall health, and the options you have when they are not so healthy. Our guest today is Dr. Vinay Nair, the medical director of the kidney transplant at Northwell Health and associate professor of medicine and surgery in the division of kidney diseases and hypertension at the Zucker School of Medicine at Hofstra Northwell. Dr. Nair, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you, Jeanine. Thank you for having me, allowing me to speak about my favorite organ, the kidneys.
Okay. So tell us about your background. What made you want to become a nephrologist?
I have to say, kidney disease is involved with a lot of physiology. So when I was in medical school, it always interested me. But it was really not until I started residency when I decided, nephrology was for me. Nephrology is, kidney disease, basically. And I think I had some really great mentors. I think that's part of it. And I was just fascinated by the kidney. The kidneys don't get enough respect sometimes. You think of them as these two organs that are basically filters, but they influence everything in your body. And that's what kind of fascinated me, that these two little organs are responsible for so much in the body. And to really understand your kidneys, you need to understand medicine and vice versa. So I was always fascinated by kidney disease. And, in my first year residency, I knew it. And I had mentors that said it too, like, you need to be a nephrologist.
So they are very important and complex organs. So tell us a little bit about what they do for us.
Yeah, absolutely. So again, they're, maybe besides the brain, probably the smartest organ that you have. Not the heart, but the heart is basically a pump, right, with an electrical circuit. The kidney is really a lot more. So at their most primordial function, they're filters, right? They filter our blood. They get rid of extra chemicals in our blood and they deposit them in the urine, but they also metabolize chemicals. They're really important in controlling your blood pressure, controlling how much fluid you have in your body. They're involved in your electrolytes, producing red blood cells, believe it or not. Not that they produce them in the kidney, but they produce a hormone that causes your bone marrow to produce red blood cells. They're important in your bone health. They're important, again, in the blood pressure. They're important for your heart health, too. People with kidney disease often don't die of kidney disease. They die of heart disease. It's considered a major risk factor for cardiovascular disease. One of the largest risk factors is having kidney disease. Yet most people don't recognize how important the kidneys are and what role they play in our health.
So how can we protect our kidneys?
So I think the first thing, Jeanine, is understanding that we should ask about our kidneys, right? So if I asked you, or if I asked someone else that's, listening to this program, do you know anything about your cholesterol? Like, you may not know the exact numbers. Is it good? Is it bad? They'd probably say, yeah, it's okay, Or if I ask you about your blood pressure, most people can say, yeah, my blood pressure is pretty good. Or, it's got some issues. Or even your blood sugar, right? When we talk about diabetes, how's your blood sugar? What's your A1C? People have an idea. But if I was, maybe you would be able to answer this, but if I was able to ask the majority of people, what do you know about your kidneys? Nobody really knows. Right? Nobody really knows about their kidneys. Yet 1 in 7 people in the United States, 37 million people, has some degree of kidney disease. 90% of people with kidney disease, severe kidney disease, don't even know they have kidney disease. So I think the first thing we need to recognize is we need to ask about our kidneys and pay a little bit more attention to them. And it's simple, every time if you see your doctor and get a blood test done, they're performing certain tests that can tell us about our kidneys. The simplest one is called the creatinine. Creatinine is a chemical. It's produced by your muscles and it's filtered out through your kidneys. So if your filter is working right, your kidneys are working right, the creatinine is filtered out and the amount of creatinine in our body is low. And it turns out the number is really easy. A normal creatinine is about 1. Now, academics will argue about this and say, well, creatinine is not the best marker. But if your creatinine is above like 1.2, 1.3, then you want to ask, why is that so? Are my kidneys really okay? So normal is about 0.8 to 1.3. Just think of it as 1. The other marker, if you really want to get fancy, is something called the GFR. It's your glomerular filtration rate, or basically the amount of blood filtered by the kidney. And it turns out normal is about 100. As our kidney function gets worse, as the creatinine increases, the GFR decreases. It means your kidney's not filtering as much blood. Instead of that 100 milliliters per minute, it might be filtering 50 ml per minute. And we have stages of chronic kidney disease based on this number. And if you've heard of dialysis, dialysis is when people really reach, below 15 ml per minute of blood filtered. Again, I think that's the first thing to know. Educating ourselves about the kidneys, realizing that when we get blood tests done, your doctor's almost always looking at your kidney. And just asking about it. I think that's the first step.
So if I have diabetes or hypertension, can I expect that over time my kidneys will be negatively affected by these chronic disease processes? And why?
That is a great question. And that kind of circles back to your initial question. What can we do to kind of keep our kidneys healthy? So I told you 1 in 7 Americans has kidney disease, some form of kidney disease. 1 in 3 diabetics may have kidney disease, 1 in 3. And with blood pressure, hypertension, it's about 1 in 5. So just to make it kind of simple, with diabetes, there's too much sugar in your blood. And this excess sugar kind of gets deposited in different forms in all of your tissues. The way I think of it is it kind of clogs things up and causes inflammation. So if the blood vessels in your brain have too much of this deposition, right? Then you end up having strokes, for example. In the heart, you get heart disease. In the kidney, you get kidney disease. In your eyes, you get vision problems. In your nerves, you get neuropathy or burning and pain in your fingers. So it's related to kind of too high blood sugars, and they cause inflammation and other problems when they get deposited sort of in your tissue, so to speak. So what we can do is, first, we need to know if we're developing problems like diabetes. And then what we have to do is treat this, make sure we control our blood sugar. Let me even take a step back. Let's just try and avoid having diabetes, right? I think in today's day and age, we work hard, and we play hard, and we're often sedentary in our jobs. Our diet isn't the best because we're so busy. We don't make the time to exercise, and we don't make the time for our mental health. And I think it's important that we do make time for ourselves. We eat right. We take care of ourselves. So we avoid developing these problems like diabetes. But if you do develop it, there are things you can do. You can change your diet, and if you need to take medication, you can take medication. But the idea is to control your sugars so they're not getting sort of deposited in your tissues and causing inflammation and ongoing damage.
So you mentioned also hypertension. Yeah. So is that similar to diabetes in that, it causes a perfusion issue or blood flow issue to the kidney? And what happens as a result of hypertension?
Yeah, hypertension actually is a little more tricky, believe it or not. So severe hypertension, really uncontrolled high blood pressure, can absolutely affect the kidneys. And just think of it as if you have a pipe and you're running higher pressure liquid through it, the pipe being your blood vessels, you're running higher pressure through it. Whatever that pipe is leading to is going to be hit by this higher pressure and cause some corrosion. And that pipe itself is going to start getting eroded. I think that's sort of the simplest answer for high blood pressure. It's sort of a corrosion that occurs, damage to the lining of those blood vessels, and that lining gets thickened, and it just kind of feeds into itself and worsens it.
How How do I actually know I have kidney problems, that I'm starting, my kidneys are not really sufficiently working?
Just to finish up the thought on hypertension, because high blood pressure can cause kidney disease, but often kidney disease causes high blood pressure. That may happen even more often than high blood pressure causes kidney disease. So answering your question, if you have high blood pressure, you should definitely check your kidneys. High blood pressure may be a symptom of kidney disease, and it often is the first sign of kidney disease. So it's not really a symptom necessarily. Not everyone gets symptoms of high blood pressure. You may have headaches, for example. Some people don't, but it's a sign of kidney disease, definitely. If you have high blood pressure, again, if you're with 5 people with high blood pressure in a room, or in this day and age, if you have a Zoom meeting with 5 people, one of them with high blood pressure, one of them probably has kidney disease. So one of the first signs is high blood pressure.
And what happens to my urinary output or my ability to urinate or make urine?
So here's the tricky part. Initially, nothing. Stage 1 kidney disease, nothing. Stage 2, nothing. Stage 3, really minimal. It's only until you start kind of hitting stage 4, blood pressure goes up. You may not notice that you're urinating less, but you're getting rid of less salt and water in your system. So you might notice, well, I'm getting a little bit of swelling in my legs. I start getting short of breath when I'm walking. When I walk up a hill, I just can't exercise like I did before. Many people we see with kidney failure say, well, I thought I just kind of had a flu. I just wasn't feeling well. Also, like I said earlier on, the kidney is responsible for producing red blood cells, right? Not directly, but through the bone marrow. So people develop anemia. Their red blood cells counts decrease and they feel more tired, fatigued. So it's a lot of non-specific symptoms, and often at later stages of kidney disease. It's fatigue, weakness, shortness of breath, maybe some swelling of the legs. Maybe you notice a little less urine output, a little blood in the urine. That can be from the kidneys. If you notice blood in the urine, you definitely want to get that taken care of. And some people just see very foamy urine. That can be a sign of too much protein excretion in the kidneys. And kidneys are a filter. Proteins are large. They shouldn't get through the filter pores. If they do, that means there's damage to the pores, or in other words, damage to the kidneys.
What are some of the treatment options? If I'm having damage to my kidneys, how do you treat it?
It sort of depends. So this goes into 2 types of ideas. There's acute kidney disease and chronic kidney disease. Most of what we've been talking about is chronic kidney disease, from diabetes, high blood pressure, diseases that occur over years and years and years. But there's another category. So for example, people have some autoimmune diseases like lupus. That's where your body attacks the kidneys. So if you have an acute kidney disease, sometimes it can be treated through medications. Medications can calm down the inflammation and the kidneys get better. But I think most of what we're talking about today is chronic kidney disease. And unfortunately, it's very hard to sort of reverse damage that's been done. So what's happening is little by little, your kidneys are scarring. And scarring in the kidneys are just like scarring anywhere else, right? If you get a big burn in your arm and a big gash in the other arm, once they scar, they kind of look the same. Mm-hmm. And you can't really tell which one came from what. And it's very hard to get rid of a scar. But there are things we can do to prevent progression. So for example, blood pressure control, blood sugar control. And there's certain medications that we use for blood pressure that are especially helpful. And it turns out that a lot of people, the majority of people with kidney disease, don't end up with kidney failure. Kidney failure is in about 700, 800,000 people in the US. But like I said, about 37 million have some form of kidney disease. Wow. It's that people with kidney disease often will die of heart disease or other problems. By controlling the progression, we can expand someone's life to a normal lifespan by using these medications, doing the right things in terms of diet and exercise, using the right medications, controlling the sugar, controlling the blood pressure.
Does it mean that I'm on these medications for life?
It depends on kind of the disease. So, for example, diabetes. If you have diabetes associated with a poor diet or being somewhat overweight and you lose 20% of that weight, or you really change your diet, you can reverse diabetes. You can kind of eliminate the need to take any medication and have normal blood sugars. That can also improve your blood pressure dramatically. If you're able to do that, then you don't necessarily need these medications. If it's genetic, and often it is genetic, often there's, let's be honest, sometimes, there's not, you can do everything right, but you can still develop diabetes or high blood pressure. Mm-hmm. In those cases, these medications will help. And, unfortunately, you probably would benefit being on them for life.
So can you explain what dialysis is?
What we were just kind of discussing is sort of the first step in treating kidney disease and trying to prevent progression. But like I said, and like you're asking, of those 37 million, a few years back, it was about 700 to 800,000 people ended up with have end-stage kidney failure. When you have end-stage kidney failure, there are a few options. There's dialysis and there's transplantation. Those are your options. There's two forms of dialysis. One is called hemodialysis and the other is peritoneal dialysis. Hemodialysis is where you either have a catheter kind of in your neck or what's called a fistula. It's a surgical connection between an artery and a vein. And basically you get this kind of large blood vessel here. And there's a machine with a filter on it. Basically the filter, you attach it either through that large blood vessel or through the catheter. You pull blood out, you put it through the filter, you clean it, you get rid of extra fluid, you add certain hormonally active medications that you need, and then you return the clean blood back to the person. So the way dialysis works is you usually will receive a treatment, which is about 3.5 hours, and you usually get that treatment for about 3 days a week. And it works, but it's not as good as having a kidney.
Yeah.
The other is peritoneal dialysis. That's where we put a catheter actually in the abdomen. We instill fluid in there, or you instill fluid in there, and the toxins move from your abdominal cavity, the blood vessels lining your abdominal cavity. They get absorbed into this fluid that we call dialysate fluid. You let it sit there for a certain amount of hours, and then you drain it out. Many people do this overnight. So this is sort of a home option. The first option, hemodialysis, is usually in a center. If you have a caregiver, you can have it at home too. So that is a growing opportunity. Peritoneal dialysis is always done at home. There are machines called night cyclers that can do the dialysis at night while you sleep. So it allows a lot less restrictions, a lot more freedom for life. And early on, peritoneal dialysis probably has some benefit in terms of like longevity of life. But the problem is, in general, 50% of people, 50 to 40% of people who start dialysis 5 years later actually die, which is sort of shocking, right? And I don't want to confuse anyone. There are plenty of people who live a lot longer than 5 years, 10 years.
What do you attribute that to? Why do you attribute that to? Infection?
Your kidneys are working 24 hours a day, 7 days a week. And like I said, your kidneys are very smart organs. They're doing a whole lot of things. Dialysis is man-made, right? And we've come a long way. If you have liver failure, there's no dialysis. There's no replacement for liver failure. Kidney failure, we have this. But dialysis is removing chemicals, toxins, but it's probably removing some protective elements in our body too. And we're giving back certain hormones, but not all. And the other part of it is it kind of puts your body in shock. So by the point you need dialysis, many people are not urinating. So if you drink a gallon of fluid a day, which you shouldn't if you're on dialysis, but say you do, and you're getting dialysis 3.5 hours, 3 times a week, that means in that 3.5 hours, they're removing a gallon of fluid. That's shocking for your heart. To remove a gallon of blood volume, of fluid volume in 3.5 hours, if we did that to you and me right now, we would not feel well. And neither do patients on dialysis. Mm-hmm. It's too much. It's a rapid change. It's a rapid shift. It causes a lot of inflammatory chemicals, and it's a lot for the heart to take. It's a big shift. Peritoneal dialysis is a little more gentle. It's typically at night, but it's kind of the same problem. And people get cardiovascular disease. Like I said, the kidneys are very important in maintaining bone health. So the calcium goes into the bones. When you have kidney failure, the calcium doesn't go into the bones as much as it should. It ends up in blood vessels. And the blood vessels get calcified and hard. You get heart disease and other blood vessel disease. And people can get quite sick. And those outcomes are worse than many cancers. But we don't think of kidney disease being as bad as cancer, right? But it's a real problem.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about your kidneys, why they are so important to your overall health, and the options you have when they may have a health problem. Our guest today is Dr. Vinay Nair, the Medical Director of Kidney Transplantation at Northwell Health. and Associate Professor of Medicine and Surgery in the Division of Kidney Disease and Hypertension at the Zucker School of Medicine at Hofstra Northwell. So, Dr. Nair, tell me more about kidney transplant. How do you get on the list? Who's really qualified for a kidney?
Great question. And so we were talking about dialysis before and the problems associated with dialysis. And right now, the best treatment is actually if you don't need dialysis, if you go straight from kidney disease to a kidney transplant. Or if you need dialysis as soon as possible, you get a kidney transplant. Now, back 50 years ago, it was really very healthy people, young people getting kidney transplants. Today, we can offer kidney transplants to almost anyone. Truly, there's no age limits per se. You just need to be relatively healthy. And what I mean by that is you can't have sort of end-stage heart disease, end-stage liver disease. You can have some heart disease, some liver disease. You can have diabetes. You can have high blood pressure. You can have many different problems and still be a candidate for transplant. So your kidney function, first of all, if you are planning to get a transplant, has to be reduced. So remember that number I mentioned, the GFR. That's how much blood your kidney filters per minute, ml per minute. It needs to be, in general, under 20. So once it's under 20, your doctor can refer you to a transplant. Well, they can even refer you earlier. But once it's under 20, you can be put on the kidney transplant wait list, the national wait list, and start gaining wait time for a transplant as soon as it's under 20. Alternatively, if you're already on dialysis, it's not another great opportunity to get involved and evaluated for a transplant. And then you can get listed. And you don't lose time. So what I mean by that is if you get listed for a kidney transplant, but you've been on dialysis for 3 years, your wait time on that list will begin 3 years ago when you started dialysis. So it's never too late is my point. It's never too late. And my other point is almost anyone can be a candidate. The majority of people are candidates. It's really only if you have really, really severe sort of end-stage organ disease besides the kidneys that you may not be a candidate.
So is there a cutoff date? There's a cutoff age for candidacy?
There isn't. There is not a cutoff age. It depends. So, some people are 75 or 80 years old, but healthy. Mm-hmm. Maybe healthier. You may have an 80-year-old individual who's healthier than, a 50-year-old individual, So it's not all about age. Age should not be a deterrent. You need to be seen by the transplant team, which includes a whole number of transplant professionals, a surgeon, a kidney doctor like myself. We usually work with a heart doctor, a cardiologist. The goal is to make sure that you can be successfully transplanted and we can improve your quality of life. If we can't, and we feel like we would harm you, that's when you're not a candidate. But again, the majority of the people are candidates. There really isn't a cutoff on age.
What if I wanted to be a donor? What if I wanted to give one of my kidneys? Can I live on one kidney?
Yeah, great question. So just to give you a little bit of background, the United States in 2021, there was about 25,000 kidney transplants done. And there's about 90,000 people waiting. Of that, about 25%, or 6,000 to 7,000, were living donor transplants. So about 25% again. So living donor transplant is really the best way for a person in need of a kidney to receive a kidney transplant. Why? First, you don't need to wait. In the United States, people wait a couple of years for a transplant. In New York, unfortunately, people wait longer, 3 to 5 years. You don't have to wait if you have a living donor. Because there's no wait, you can get a transplant even before requiring dialysis. So that's a benefit too. Now, what are the qualifications for a donor? Really, we want to make sure that by someone donating their kidney, they are not going to be at a higher risk of dying or a significantly higher risk of kidney disease. So the main thing is you can't have risk factors for kidney disease, or you can't have diabetes, for example, because like we spoke about, diabetes affects the kidneys. So it wouldn't make sense for a donor to have diabetes. Hypertension is a little bit tricky. If you're an older individual and you have well-controlled high blood pressure, you may be able to donate. There is no true age cutoff. Usually as we get older, the kidney function does decline. So it's a bit unusual to have donors above the age of, say, 75. But it really depends on their kidney function. So you need to have robust, good kidney function. The GFR number typically needs to be above about 80.
Does insurance cover it?
Yeah, so insurance actually, it's covered by the recipient's insurance.
Oh, good.
Yeah, so because, for the insurance company, it's the right thing to do, number one, and I still think that matters the most, but also it's cheaper. It's cheaper to maintain someone with a kidney transplant, to get them their medications, take care of them, help them get to their doctor's appointments, than take care of someone on dialysis.
And how good is that kidney? How long does the kidney last?
Good question. So a living donor kidney, the success rate is about 98, 99%, and it will last about 15 to 20 years. Okay. In general, With a deceased donor kidney coming from someone who's passing away or brain dead, those kidneys last more about 10 to 12 years on average.
If I wanted to know more about kidney health, is there a way that I can contact you or Northwell?
Yeah, absolutely.
Website.
So, you can always call our transplant center. So I'm a transplant nephrologist. So our phone number, for example, is 516-472-5800. I'm more transplant. We have a beautiful, wonderful general nephrology team too for the earlier stages of kidney disease. You can find us online on the Northwell Health website. If you want to just learn more about kidney disease, you can look at the National Kidney Foundation website, the NKF. A lot of the facts and the statistics I'm giving you come from the NKF. And I just want to mention, we talked about living donation, but in New York, we don't have enough organ donors that are deceased donors. Log on to Live On New York if possible. That's our organ procurement agency, Live On New York. You can learn about kidney donation. You can register to be a kidney donor. And, the beautiful thing is sometimes even in death, you can save lives, up to 8 lives with one person who decides to donate their organs.
Excellent information. So I just want to say I thank you for being here, Dr. Vinay Nair, the Medical Director of Kidney Transplantation at Northwell Health and the Associate Professor of Medicine and Surgery in the Division of Kidney Disease and Hypertension at the Zucker School of Medicine at Hofstra Northwell. We hope you stay safe and continue to stay healthy, and thank you for being our guest today.
Thank you. Thank you so much for having me.
This is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.